I'm going to wash my hands. My name is Caroline Nebo. I'm going to be a nurse for today. I just wanted to check with you. Are you in any pain? Are you allergic to anything? I would like for you to give me two identification. That will be your name and your birthday. Great. Well, the reason I'm here today is to do an assessment on your face, the mouth, your eyes, your throat, and your ears. It's going to take me around 10 minutes. Is that okay with you? Great. Okay. We're going to start with your eyelids, and your eyebrows, and your eyelashes. That's symmetrical. I don't see no tenderness, and I don't see any edema. Okay. The next thing we're going to do is going to be the visual field. If I was doing it on a human being, they will have cover one eye, and I'll cover one. But since I'm doing it with a zebra, and the zebra can't hold, so I'm going to hold it for them. I'm going to pretend I have one. I'm going to cover my own one eye, and I'm going to cover theirs. And this is for the visual field. So I'm going to start in the middle. I want you to follow my hand. I'm going to bring it back in the middle. I want you to follow. I'm going to bring it back, and I want you to follow. And next, I'm going to turn here, do the same thing. So follow my hand, bring it back, follow, bring it back, follow, and bring it back. Okay. The next thing we're going to do is going to be the corneal reflex. Corneal reflex, I'm going to hold my pen, and I want you to follow this pen, okay? It's going to take it, follow, take it, follow, bring it down, and I'll follow. I'm going to do the same thing that we did on the other side. So I'm going to take it right there, I'm going to follow, take it in the middle, follow, I'm going to take it down, and follow. The next thing we're going to do the cardinal position gaze, okay? I want you to gaze it. And that's what we just did. You follow my pen, you gaze in, cardinal gazing, and gaze. Okay, I'm going to do the same thing. And gaze, and gaze. There's no nystagmus, and there's no trimmus. Okay, great. The next thing we're going to do, looking at everything, I'm going to look at your pupils. Okay, going to check, make sure they're equal. Okay, I'm going to take this pen, I want to bring it right in, check, I'm going to take it over here, I'm going to check right there, and your polar at 3 and 5 millimeters. Okay, I'm going to put the pen right here. So next thing I'm going to do, I'm going to check your conjunctiva, pink, And while I'm doing that, I'm going to check the lacrimal glands, which are right there, and also your sclera is going to be white. I'm going to check your cornea. It's moist, and your iris. I already did your pupils, and I can check them again. Check your pupils again. Okay, and check this. Okay. Then I want you to look. This is a combination. I want you to just look at this pen straight. I want you to gaze, look at the wall. Okay. Okay, good. So next thing I'm going to do, I'm going to check your ears. I'm going to start from the back of your ears. I'm looking at the skin condition. I'm going to see if I could see any lesions, any bruises, or skin breaks. The condition and the color, and the position, and the alignment. Color is same with the face. I'm going to check off your arcuate, euclid. I'm going to check on your triangles, see if they're tender. I don't feel no tenderness. Check. See if there's any piercing. I see no piercing. Okay. The next thing we are going to do is we're going to check on your nose. Okay. Well, on the nose, he doesn't seem to really have a nose, so I'm going to do part of it on my nose and part of it on the giraffe nose. So when you're checking for potency, you press one of your nostrils down, which will be like pressing his nostrils down. That's checking for potency. You do the same thing on the other side. Okay. Then the next thing you're going to do, you want to look inside what you're looking for, the septum. You look to see if it's intact, which is going to be like checking, pretend. And if the septum is intact, then what you're going to do, you're also looking for tuberna to see if they're pink. You know, if you look inside your nose, which I can't see my nose, but if you look inside, the tuberna is going to be pinky looking. Okay, so that's what you check on your, you're checking to see if the septics, they're intact together, and if the mucous membranes are they're looking okay, they're clear. And then also you also check for by the way, for the eyes, you check for the lacrima, which I did check. Okay, so for the nostrils, we're done. So the next thing we're going to check now, we're going to check for just in general, the sinuses. So I'm going to put my pen. So you have the frontal sinuses. Kind of press a little bit on it. You feel any pain? Okay. The maxillary sinuses. See if they're positive translumination. Okay. All right. So the next thing you check is going to be the mouth. Checks for the lips. You check for the tongue. Well, he doesn't have a tongue. He has a mouth, but he doesn't have a tongue. So I'm going to pretend I can see my tongue, so that you you look inside. So tell the patient to open their mouth. You look. You're looking for the uvula. It's gonna be hanging. Look at their tongue. You check their teeth. And then once you check, which I'm going to be pretending I'm checking right here. So you check for the gagging. Take a piece of thing, and you place in your mouth. You're going to hear gagging sound. Ah. That's good. You're checking for the gagging reflexes. Okay. So the other thing, after you've checked for their tongue, you check for their uvula. You check for their gagging reflexes. You check for their teeth, to see if they have all their teeth, which they do. Check to see if there's any cavity. If they have any cavities on their teeth, you've checked for their lip color and all of that. So everything looks good. I think we're done with our assessment for today. Is there anything I can do for you? Would you like something to drink? Are you thirsty? Or would you like a pillow? If you can think of anything, I'm going to give you a call light. Whenever you think of something that you need, don't hesitate to call. And let me know. Again, my name is Caroline, and I just want to thank you for choosing our hospital. And I'm glad you're here. And we are here to assist you in any way or form. And you have a blessed day. Thank you very much.